This is the hip bone, and it has three parts: ilium, ischium, and pubis. Pubis is from the 1/5 of the acetabulum. The pubis has three parts: superior ramus, body, and inferior ramus. The body is quadrilateral in shape, and the body has three surface and three border: anterior surface or femoral surface, posterior surface or pelvic surface, medial surface or symphyseal surface, pubic crest at the upper border, and this is the pubic tubercle, and lateral border at the obturator foramen. Anterior surface is directed downward, forward, and laterally. Anterior surface gives origin of the tendinous adductor longus. Here's the gracilis, and we have the adductor brevis and obturator externus muscle. This is the posterior or pelvic surface. Posterior surface is smooth and forms the anterior wall of the bony pelvis. Close to its center, the surface gives origin to the anterior fibers of the levator ani. And this is the medial or symphyseal surface. Medial surface is covered by a plate of hyaline cartilage and articulates with the similar surface of the opposite bone, separated by a fibrocartilaginous interpubic disc. This is the pubic crest, and pubic crest gives attachment from before backward to the following: fascia lata, anterior wall of the rectus sheath, the conjoint tendon, and fascia transversalis. This is the pubic tubercle and gives attachment medial end of the inguinal ligament. This is the superior ramus, and it has three border and three surface. This is the anterior border or obturator crest, extends from the pubic tubercle to the adjacent acetabular margin. This is the posterior border or pectineal line, continuous with the arcuate line of the ilium. And this is the inferior border, forms the upper margin of the obturator foramen, gives the attachment to the obturator membrane. This is the pectineal surface, intervenes between the obturator crest and the pecten pubis, and it gives origin to the pectineus muscle. This is the pelvic surface, and this is featureless and covered by the peritoneum. And this is the obturator surface, is grouped and forms the upper boundary of the obturator canal. The inferior ramus of the pubis extend downward and laterally from the lower part of the body and joins with the ramus of the ischium to form the ischiopubic ramus.